就引齊啦。
We have a quorum. I call the meeting to order. First of all, I'd like to say that there is only one item on the agenda. We have invited deputations and individuals to come to express their views on the overall strategy for the prevention and treatment of cancer. Information Services Division of the LegCo has also prepared an information note on cancer strategies in selected places. It has been given to members. Let's invite deputations, individuals, as well as government representatives to come in to join us. Welcome everyone. We have with us Undersecretary for Food and Health, Dr. Choi Tak-yi, Director, Cluster Services Hospital Authority, Dr. Tony Ko, Consultant Community Medicine Non-Communicable Disease, Department of Health, Dr. Rita Ho, Acting Principal Assistant Secretary for Food and Health, Ms. Clarissa Wen, and Senior Manager Integrated Programs, Hospital Authority, Dr. Eric Zhe. We have also received submissions from deputations. First of all, I'd like to ask Dr. Choi, Under Secretary for Food and Health, to take us through the paper. There is a paper provided by the administration for this meeting. Dr. Choi, thank you. Welcome to this subcommittee meeting on issues relating to the support for cancer patients. This is a public hearing. Well, cancer is a major public health issue in Hong Kong. With a growing and aging population, the number of new cancer cases and related healthcare burden are expected to increase. Back in 2001, the government established the Cancer Coordinating Committee, chaired by the Secretary for Food and Health. It is responsible for formulating strategies on cancer prevention and control, and the steering of direction of work covering 4 areas. There was a public hearing conducted last year. We have received a lot of comments. We're of the view that it is necessary for the government to formulate a set of strategies applicable to Hong Kong. The Cancer Expert Working Group on Cancer Prevention and Screening will take into account local and international evidence and come up with strategy on prevention of cancer. We are working on the strategy. We would like to set down a framework based on patients, and it will cover screening, prevention, surveillance, early intervention, early identification, etc. Once we have the strategy, it will be discussed by the coordinating committee. We hope that we will be able to come up with a final version of it within this year. As the Undersecretary said, that we have about 30,000 new cases every year, and there is a chance that the number will continue to climb. From the research of a number of countries, it's shown that if there is targeted support given by the government, cancer patients' survival rate will increase. We thank deputations and individuals for attending this meeting to give us your valuable views. These views will be taken into account by the administration. If you've been to the electrical public hearing, you will know that there is a microphone and an earpiece in front of you. Channel 0 is the floor. One is English. One is Cantonese. 2 is English. 3 is 普通话. What you say here and what you say in your submission is not protected by the Electrical Powers and Privileges Ordinance. Please also pay attention to the points to note to members of the public attending meetings in the Legco. We have already given you the number. You'll be asked to speak in accordance with that number. You will be given 3 minutes each. First, a cancer patient would like to speak first. Well, I will ask number 1 to speak first, Mr. Ryan Young. May I start? Good morning. Good morning, everyone. My name is Young. I represent Happy Retired Company Limited. Our target group are those who have just retired or about to retire. They are about the age of 60. I would like to speak for them. For those who are about to retire or those who have retired, they're very concerned about cancer because it will easily exhaust their lifetime savings. In recent years, the government has put in a number of initiatives to screen, say, for example, colorectal cancer. But what about a similar scheme for lung cancer? Because lung cancer is quite common as well. We're aware that in Macau there is a screening program for lung cancer. We hope that a similar screening program will be put in place in Hong Kong. Well, we have about tens of thousands of members. They have some grievances, but they've just retired and they have been paying a lot of tax, but when they retire they don't really enjoy much benefit, especially in relation to healthcare. Well, if they're middle class, then they may have a few $1 million to use, but if they have cancer, they will spend the lion's share of their lifetime savings. On top of that, they are not eligible to apply for various subsidies under different schemes. Say, for example, the community care fund. Perhaps the eligibility can be relaxed under the CCF, so that should these people have cancer, then they will receive some kind of subsidy. In relation to the hospital authorities' drug formulary, perhaps there can be some kind of a mechanism to enable middle-class people to enjoy the benefit. In Japan, there is a phenomenon. They elderly people who move downwards in the social ladder. If they have cancer, then they will use a large amount of their savings, and afterwards they have to live in poverty. We are very concerned that Hong Kong will follow the footsteps of Japan. We hope that the government will provide assistance to them so that they don't have to exhaust their lifetime savings on treatment. So on the drug formulary as well as the screening program for lung cancer, we ask the honorable legislators to help them so that they can lead a dignified retirement life. I ask government officials to be understanding and caring. Thank you. Legislators have the duty to speak for the public.
Mr. Chen Ka-long, thank you, Chairman. I have prepared a submission on breast cancer. The one next to me is a recovered patient, so I think it is better for her to talk about breast cancer. Let me talk about two commonly seen cancers among males in Hong Kong, lung cancer and liver cancer. Well, I think there's a friend, Mr. Lai Ming Hong, friend of the minibuses, who is well known to many, suffered from liver cancer, and 4 months after diagnosis, he passed away. So this is sort of my first-hand experience because it has been 4 years already since his death. This is recorded on Facebook. In the government's drug formulary, there is only one medicine available for patients. And in fact, there was not much choice before that. Recently, US FDA introduced a new medicine, and it is proven that it can prolong survival of patients. And the biggest advantage is that there are very few side effects. There won't be pain on the limbs. So now, we know that that medicine is already registered in Hong Kong. However, it is still not included in the drug formulary of the Department of Health, and also the first phase subsidy scheme of the CCF. So some poor patients cannot afford the drug, so it would be better to offer financial assistance in this regard. Now let me turn to lung cancer. Apart from chemotherapy, the other two methods are immunotherapy and also medicine. So it all depends on whether the lung cancer is because of a genetic mutation or not. So if it is genetic mutation caused, then it should be cured by or treated by medicine, and vice versa. So there should be more choices for doctors and patients in terms of treatment method. Now, using the above-mentioned two methods will cause fewer side effects. There would be less hair loss. I think this is known to everybody. Another point is I hope that there should be 4 checks or examinations every year instead of 2. Because if patients have to wait 4 months, they may not be able to afford that. On the 4th of May, there would be a seminar or symposium on cancer. So if you are interested, please attend it. Mr. Chen, if you have more information concerning the drug you mentioned, please give it to us so that we can pass on to the related official. Ms. Leung Shuk-yi. Good morning, Chairman. I'm happy to have this opportunity to share with you. I used to be a breast cancer patient. I had completed 18 months of treatment. Well, some time ago, I worked on Diamond Cap, and because workload was heavy, that's why I became sick. Now I have completed 18 months of treatment, and I'm now healthy. My hair has grown back. I have experienced breast cancer, and I used to be a journalist. And I had looked into many cases around me. For breast cancer, most patients are female. And when female patients get the disease, well, the impact is not only on her or on them. There would be impact in the workplace and to the family. And treatment will last at least half a year. For me, 18 months, because I want to complete the full treatment. However, financial is one important issue. I am lucky because I have bought medical insurance, so I can get private doctor's support. Now, for some other patients, they need HER2 treatment, and if they are not given financial assistance by CCF, then in fact they are waiting for their death. Cancer is very close to death, but does that mean that there is no hope at all? I hope more hope can be given to cancer patients. I always advise people to buy insurance. Now, at certain age, if people don't have any financial affordability, then they have to think of other medicine. Now, I am a recovered patient, so I have to rebuild my life. I want to achieve a balance in life, and I should adopt or I should develop better habits. I think support for recovered patients is much less than that for patients. But we should not underestimate the importance of that, because after recovery, there is not enough support for them to remind them about the importance of a good culture. I talked about income and savings. Now, after recovery, very few people talk about employment after rehabilitation. Now, there are 487, Cap 487 and Cap also 57 of the law. So what about the support and dignity or respect for the cancer patients? I have visited overseas websites on cancer survivorship. I hope to be able to do more in the rest of my life. Thank you, Ms. Leung, for attending this meeting, and thank you for sharing your feelings as a recovered patient. You also talked about support necessary. Now, if you represent a certain organization, please introduce your organization as well. Next, Mr. Leung Chen. Thank you, Chairman. In recent years, well, there's a saying that there is medicine, but there is no money. People cannot afford the medicine. Perhaps you have heard this many, many times, but I would like to include this sentence in my introductory remarks. It is in the heart of many patients. Some time ago, 400 million was provided to expand the formulary. There are many cancer patients who are both ill as well as poor. They need our care. But then in Hong Kong, there are also many middle-class people suffering from cancer. Now, I encountered a friend whom I have not met for the past 10-odd years. Well, he used to be an athlete, and he became very thin now because of cancer. He had worked very hard. He has his own property. He has just got married. He has a newly born daughter. He's not very wealthy, but then his family is supposed to be a very happy middle-class family. But then he lost his work capability, and he has to pay very heavy medical expenses. Now, there is a new drug which is efficacious, but then the hospital authority said that that medicine needs to be paid for by patients. And you talked about CCF and so on, Samaritan's Fund and so on, but then the means test has a very high threshold. Now, he is the only breadwinner, but then now he became the burden of his family. Every day he struggles as to whether he should seek treatment. He just wanted to live a little bit longer so that he can actually witness the growing up of his daughter, so that his daughter can still remember him. The drug formulary in Hong Kong is still not comprehensive enough, and in fact, there are a lot of barriers for patients. There is little consideration for the middle class. They even have to double think whether or not they should seek treatment. Isn't this saddening? Today, I will not criticize the government. I would like to urge you to expand the drug formulary and increase the number of beneficiaries. Please remove all the barriers and please save lives and also their family members' life. Please show respect to them and please allow them to have hope. Thank you, Chairman. Thank you. Next, Ms. Tolailin, she is number 23 originally, but she is a patient, so we would like to let her speak first. You may leave early if you need rest. All right, please. Thank you. Chairman, I would like to take this opportunity to explain why I am not trying to pick the most expensive medicine. I have gone through the 4-stage examination, and after getting the report, I present the report to the specialist doctor in another private hospital. I would like to start treatment when my condition is still not very severe. Now I have got a big tumor plus some small ones. As you know, if other treatment is used, I won't be able to bear it because the treatment would not differentiate between the good and bad cells. Now with the 3rd generation of the medicine, it will target at the bad tumor cells. So I disregard the price. I have bought 1 box. Even the doctor is willing to refer me to a government hospital. I don't know how long I need to wait. I cannot just sit and wait for my death. So I've bought 1 box. 2 weeks later, when I attended follow-up diagnosis, the cancer index came down a lot. I become a lot more energetic. The platelet count is okay as well. And in mid-April, for the first time, I visited the government hospital. At that time, the doctor did not negate the efficacy of the medicine, but then it is very expensive. So back then, the leaflet was an old one. At that time, the 3rd generation medicine is not very commonly used. And I need to take 10 doses or 10 odd doses before there will be any fee remission. Now, as far as I know, today I'm here. I don't know whether I can see you tomorrow. The system is now very slow. I won't have the blessings to enjoy the care of the government. I remember that Dr. Chan had said that if there is such a patient in a family, and if this patient needs very expensive medicine, then the family would have to use up all its savings. I was excluded from the assistance because I did not get I cannot meet the 4th requirement. I can only meet the first 3, but please don't be too rigid. Isn't it true that I am not a human being? I'm not trying to pick expensive medicines. So I hope that the government and the hospital authority and LegCo members, please do not disregard me. I'm now in a very urgent situation. The system is not a living one, but human beings are living. So I hope that you all will have heart. Apart from myself, there are other patients. I may not be fortunate enough to enjoy the assistance, but today I tried my best to come even though I was not in good shape. I just want you not to disregard the poorer ones. I have a severely handicapped, mentally handicapped son, and I don't want him to become an orphan. Thank you, Ms. To. You didn't mention the type of cancer you have. So, and also there are details about your medicine. Later on, please tell our secretariat so that we can pass on the information to the government. Next. Ms. Zhang Chek-yi. Good morning, Chairman. Cancer is an important topic in public health. And for newly registered cancer cases, the number rises every year. And public expenditure can show a very heavy burden. And for newly diagnosed cancer cases, we have seen the peak number. Now, medical technology is advancing, and there is improvement to various therapies. There are more and more recovered cancer patients. The government should be people-oriented and face up to the situation. All policies and measures about cancer should be strengthened. Concerning preventive care and also early stage treatment, well, I think we saw very serious cancer cases among ladies.
I think there should be early identification of cancer patients, because with that, there can be a survival rate of 90%. So a breast cancer screening program should be put in place so that there can be early identification and early treatment. This will also alleviate public healthcare expenditure and burden. The government should not be calcified. This program should be launched as soon as possible for the benefit of the public. For those who are chronically ill and those who are suffering from cancer, better drugs should be made available for them. Expensive drugs are not included in the drug formulary. A lot of middle-class people will have to sell their properties just to pay for the drugs. The scope of the formulary should be expanded. Subsidy schemes should be expanded. The means test should be lowered. Means test threshold should be lowered so that more patients will benefit by having the financial burden alleviated. They should also mirror the practice of Singapore and put in place measures to allow limited registration of medicine graduates from renowned universities so that they can work in a public sector. If they can work in the public sector for 5 years, it will enhance their knowledge. If they don't perform as well as we expect them to, we can simply ask them to leave. This will also alleviate manpower shortage in the public sector. Better service can be provided at the same time. Thank you. Next, Mr. Chung Mei Hong. Thank you. Well, I'm a district councillor independent of any political affiliations. I would also like to speak in my capacity as a family member of a cancer patient. My family member has been diagnosed to have cancer about 2 years ago. The illness has made our lives very difficult. I ask people not to be mean to cancer patients and their families. My family members suffered from a stage 4 of colorectal cancer, and he had to see the doctor and had to go through 3-day chemotherapy treatment. Well, there is a serious manpower shortage for oncology. In the public sector, you will have to wait till after 5 o'clock before you can see the doctor, you will have to wait for 2 or 3 hours. And this shows that there is a serious shortage of service. Every time you see a different doctor, so there is no consistency. There is no one single doctor that will follow your case the whole time. And I'd also like to talk about insufficient healthcare resources. The chemotherapy was not effective. Well, the doctor advised us to take the patient to seek a palliative treatment. We took my family to a private doctor, and the private doctor said that there are other alternatives. My impression is that because of shortage of resources, they have chosen to give up on patients who are in later stage of cancer. They would rather spend resources on younger patients or patients at an early stage. Mr. Wong talked about there was a downward mobility amongst elderly people. I am not a middle class, but still, CCF or various subsidy programs will turn us away. My family suffers from colorectal cancer. Colorectal cancer is one of the most common cancer in Hong Kong. Well, when it comes to TAS 102 and some more advanced or targeted therapy treatment, they might be registered, but there is no subsidy. Every month it will cost just $60,000 in the private sector. If you're a legislator, you may be able to afford it, but for just an ordinary member of the public, how do you expect the family to be able to pay $60,000? Why can't the drug be included under the CCF program? The financial burden has driven us to near desperation. It's not just the illness. Thank you, Mr. Zhang. Next is Mr. Fong Ka Leung. I would like to follow up on what Mr. Zhang said. Well, suffering from illnesses is part of life. If you have cancer, of course, you would like to use different ways to treat the illness so that you can live. Starting from 2016, well, it says that over 30,000 cancer cases are new ones, but half of them might end up in death. We have a very good technology to treat cancer, but the drugs themselves are very expensive. About 30 years ago, my dad had cancer. The initial diagnosis was that the tumor in the liver was about several centimeters in size, so it was about to die. But a doctor in Queen Mary Hospital insisted on trying something new on my dad. Every month, my dad had to go to Queen Mary Hospital to have an injection directly into his liver. Well, he had this treatment for over 10 years. He lived for another 10 years, able to see his children get married, but it cost about $2 million. And it was expensive at that time. There was no insurance coverage. Properties had to be sold. grassroots families simply won't be able to afford it. So there is room for improvement. The drug formulary scope should be expanded. Expenditure on drugs should be tax deductible. There should be more public-private partnership. Some people would like to seek treatment from Chinese, traditional Chinese medicine practitioners. But it's not the case that you should stick to either Chinese or Western medicine. But the two should work together to find a better way to treat cancer patients. Thank you. Next, Mr. Chen Wai Kit. Thank you. We are Cancer Patient Allowance. We're a patient group. We have 9 proposals to make. Well, you should start treatment when the illness is not serious. So there should be early identification for early treatment. 2, waiting time for first consultation for breast cancer or other cases. Well, if you require radiological service, you will have to wait for a month and a half. If the service can be improved for waiting time to be shortened, it will be better. Volunteer workers should be strengthened for better support to patients as well as their families. We hope that new drugs can be included into the safety net of the various programs. If the drugs are too expensive, it will be no use to cancer patients. 5, well, drugs are already very expensive. I understand that we can't rely fully on the government. We hope that during that window period, there can be some compassionate subsidy program to help those who are in financial need. 6, we would like to have a program under which a cap is placed on the drug expenditure so that we will have an idea whether we will be able to afford it. Sometimes we will have to try the drugs out. And if the drugs don't work, perhaps you can ask the pharmaceutical companies not to charge us. When we try new drugs or expensive drugs, there can be consultation service by pharmacists so that we'll understand that there will be side effects and whether the dosage is too strong or not. Questions can also be answered. It will be good for patients. 8, the safety net. Some patients told us that for MMS, well, 2 targeted drugs will have to be used. However, only 1 can be subsidized. So should patients use the drugs or not? 9, we can all do a little bit more. We can set up a clinical trial center as well as a drug administration center, just like the one on the mainland. Thank you. Next, Mr. Kwok Wing Kin. Good morning. I'm from the Labour Party. The hospital authorities been saying that there will be suitable treatment given to patients. From what we've heard from the deputations, what happens is the exact contrary. Doctors may prescribe certain drugs, but it may be self-financed drugs and you will have to sell your property in order to afford it. $400 million will be earmarked in the budget to expand the drug formulary by including 19 more drugs. Is it really effective? Well, you have to spend about $700 million for all patients to buy their own drugs. So there is still a gap of $300 million with the $400 million earmarked. The government's been saying that it's not about money. But this time they have earmarked $400 million. They claim that it will help a lot of patients. So it shows that it is about money. The government spends a lot of money on a lot of money on infrastructural projects, $126 billion. They're very generous when it comes to these projects, but would they do more for patients? It is really shameful because Hong Kong is an advanced economy. However, if you compare to other economies, drug expenditure accounts for a very small percentage of GDP. For OECD, it's 0.6%, Japan, Korea 0.8%. However, in Hong Kong, it's only 0.28%, which is a big difference. About clinical trials of drugs, it's opaque. People don't know about the subsidy criteria, what are the symptoms you have to show before you become eligible. There is the case of Mrs. So, which has drawn public attention. Well, third-generation targeted therapy drugs has to be used, but it's self-financed. And she was told that she will have to first try the first and the second-generation drugs before she's allowed to use third-generation drugs. DHA said in their reply that they will not. The treatment decision will not be affected by subsidy programs.
So there is really this problem. The doctors already said that for Mrs. So, the third-generation drug should be used. For other patients, perhaps first, second, third-generation drugs should be used. Now, even the doctor pointed out that in some cases, third-generation drugs should be directly used. So why is it that there is a lack of flexibility and transparency in the arrangement? Thank you. Next, Mr. Wong Kah-Kay. Thank you, Chairman. According to some information, in Asian countries, cancer mortality rate accounts for 70% of the global total. Asian males are high-risk class. In 2018, for China, prevalence and mortality rates are number 1 in the world, and there is 1 Chinese in every 5 new cases. And in fact, the increase is a geometric grade. In the coming 5 years, the number will be alarming. Lung cancer, gastric cancer, and liver cancer are top killers for male, and breast cancer, lung cancer, and colorectal cancer are top killers for female. And lung cancer is common between the 2 genders. And for the 5 top cancer top causes for cancer, pollution, smoking, alcohol, and improper living habits, and also psychological factor. These are main causes causing cancer. I'm sure the SARG has the resources to change the situation. First, there should be preventive publicity to enable people to be more health conscious, and healthy living habits should be developed. There should be publicity on anti-smoking, especially for young people. In the past, I had smoked for 30 years, but I have stopped smoking. And we should encourage people to do exercise so that people won't be overweight or obese. And there should be territory-wide cancer screening so that there can be early identification of cancer. UK, Australia, and Taiwan are 3 countries which are the early birds. And for different high-risk age groups, people with different family history or genetic propensity, there should be more appropriate treatment and all-round assistance for patients and their family members. There should also be psychological counseling and financial assistance. And then drug formulary should be improved. From registration all the way to real use, the duration is more than 36 months. This is too long. We are not a third world country. We're in Hong Kong. I think medical practitioners should be very caring and conscientious. In the future, we should work with professional medical bodies of different countries to do studies on, for example, stem cell therapy and other advanced therapies. From 2010 to 2017 in Hong Kong, there are 44,000 fatal cases on average, and 14,000 are caused by cancer. In fact, that is as high as 30%. So 1 out of 3 Hong Kongers who passed away died because of cancer. So there should be a special fund out of the budget targeted on cancer. So environmental protection, food surveillance, mental health of citizens, and other areas should be looked at. So prevention is better than cure. We should remove this invisible killer, which has been in our city for a long time. Thank you. Next, Dr. Li Laifeng. Thank you, Chairman. I'm a doctor working in a public hospital. I have patients suffering from a tumor in their brain. They are in the minority because every year there are only 80 to 100 people and their lifespan is very short, usually 12 to 14 months. For these patients which had received standard treatments, including radiotherapy and chemotherapy, well, the chemotherapy drug is very expensive. Sometimes patients have to pay for the drug unless if they are eligible for Samaritan Fund. As other deputations said, many people had to rely on their own assets and savings. Even if they get subsidy, they only get assistance for 8 months. If they need the drug for a further period, they won't be able to get it. I hope the government can offer more funds for us to help these patients. When there is a relapse, we may need to offer other medicines for them. They may need genetic tests. And now patients have to send their samples overseas for a test to be done, and that may cost like 100,000. They have to pay themselves. If they can't afford it, they are waiting for their death. Now in 2005, I'm talking about the standard treatment, data 2005 for radio and chemotherapy. And now we have a new treatment, tumor treating field, data 2015. It is non-invasive, a wearable device, which helps the malignant brain tumor patients. Well, this technique came to Hong Kong at the beginning of this year. It is quite expensive, more than 100,000 a month, and it can help extend life by 4.9 months. So originally, lifespan is only 12 to 14 months. Now we're talking about a lengthened period of 4.9 months, which is quite good. And this is not a drug. It is a non-invasive wearable device. It is an equipment. But how can I bring this into Hong Kong? How can it be brought into government hospitals? In the past 2 months, I encountered many difficulties. I made many phone calls and completed many forms. Still, this problem is not solved yet. So, members, government officials, please think of ways to help us in terms of resources and money. Besides, genetic tests, next generation sequencing tests should be brought in because these are essential for target therapy. Thirdly, apart from drugs, there are also new devices and equipment. So there should be a mechanism that is clear enough for it to be feasible. Thank you, Dr. Lee. Next, Mr. Wong Wai Long. Thank you, Chairman. I am a Youth Development Officer. On the 26th April, CB bracket 21247/1819 bracket 01 electrical paper. In 2019, there are 31,418 new diagnosed cases. Cancer 15.7%, breast cancer 13.1%, prostate cancer 6.1%, bone cancer 5.8%. 2017 in Hong Kong, 14,000 odd cancer cases. Top killers: lung cancer 21.1%, colorectal cancer 14%, lung cancer 18%. Comparing with 2nd March 2018 information paper, there are an additional 1,150 new cases, up 0.7% for colorectal cancer. Chairman, for cancer patients, when it comes to scanning or a lack of surgical service, well, this is because of a lack of resources and support. When it comes to safety net, is it really a safe one? Is it true that the means test or the threshold is too high and the duration of bringing in new drugs is too long, so patients don't have medicine to take? And when it comes to scanning or other tests, people have to wait a long time. So even though there is medicine, they don't have the money to pay for it. And many patients can't afford to see private doctors. And concerning inadequate manpower in the medical field, this is not something new. You should have recruited overseas qualified doctors. And if you look at the overall long-term planning, you should be developing manpower. In November 2018, there are only 11 doctors from overseas, and the hospital authority has not recruited doctors from overseas. CCF and Samaritan Fund should speed up the vetting process. Now there is only one approval every year, and cancer patients cannot really wait. So for the anti-cancer drugs, if there are needy patients which need immediate approval, can the two funds consider that? That would be very helpful. I have 3 questions for the government. One, concerning preventive care and treatment strategy. Can it be beefed up? Secondly, apart from waiting time, anti-cancer drug is another difficulty. Can patients really enjoy the help of these drugs? Number 3, about women. Does the government have the plan to offer free medical talk and also breast cancer consultation service for those who are more prone to breast cancer? If not, why not? Thank you, Mr. Wong. Later on, the government will respond to your questions. Next, Ms. Yim Hang Wah. Thank you, Chairman. Good morning. Just now we have heard that a lot of patients in public hospitals had suffered from delay in treatment. And because of the self-financed drugs that are expensive, many people had used up their savings. There is a lack of transparency in the medicine price, and then in public hospital, there is no advice on what to do. So as a result, many cancer patients had suffered from delay in treatment. Now, there are every year more than 1,000 calls for help, and there are also family disputes. So while these patients are waiting for their death, they also face a lot of other pressure. We think that there should be a fee database on the medicines so that people know what to do and how to make decisions. There are 2 patients who had tried 2 chemotherapy drugs, but the situation has worsened. It seems the situation is hopeless. And so we told them about the price of other drugs so that they can ask doctors. They had paid for expensive drugs for 2 years, but then later on, it is only at a later stage that they know that there is a buy one, get one free arrangement. And social workers have to call up pharmacies one by one, and doctors should give advice to patients as to which financial assistance they should apply for. There are 133 anti-cancer drugs, and then which will be free of charge, under what circumstances, which pharmacies or which pharmaceutical companies offer concessionary schemes. Nobody in the HA can offer complete information. Ms. To just talked about a very complicated mechanism. Not only patients are not in the know, even doctors do not have full information. We hope that frontline medical practitioners can know drug price and assistance scheme more easily so that they can take inquiries. Now, I don't think the confidentiality agreement between the government and the pharmaceutical companies will be breached. We are talking about saving lives, and so the database should empower patients to plan for their treatment. There should be consultation service to help patients to analyze the risk and budgets of the drugs so that they can make decisions based on their own values. I think recovered patients can also share their experience and price that they know. All the information and figures are on the website. So I think if we can consolidate the information on the websites, this is like a gift to patients, very meaningful. Later on, we can seek more understanding of this present from your organization. Next, Mr. Ho Wai Hong. Good morning. Recently, the box office revenue of many films is very good, and we should not disclose the details of the films or of the stories. But as a recovered patient, I think we really want to tell others. We really want doctors and other recovered patients to share more about their experience and budget.
Just now, a lot of people have talked about subsidy, the drug formulary. Of course, I agree with them. I think a complete strategy of cancer treatment and prevention is very important. Rehabilitation is an important part and is often neglected. People don't want to get the illness, and they don't want to go through the treatment, but rehabilitation is important too. I'd like to speak on that. I am a recovered patient. I believe that a lot of recovered patients would need to exercise. I'm not talking about physiotherapy, but it's about aerobic exercises to boost your health. Recovered patients don't get any information, say for example what kind of exercises they can do. They don't have to be vigorous exercises, but they would like, say for example, whether they can do run a marathon. Such information should be made available to recovered patients. Some other people talk about the financial aspect of the illness. It is a good thing if recovered cancer patients can lead a normal life. Well, one only enjoys 120 paid sick leave, so about 4 months. You can imagine whether 4 months is enough for a cancer patient to return to a normal life. For those who are lucky, the employer will keep the job for them, but for most of them, they will have to quit the job to treat the illness. The government should do more about job referrals. They can amend the employment law, say for example to allow 1 year of paid leave for cancer patients. It is not often that we hear about survivorship, that you're not alone if you suffer from cancer. It's about experience sharing from recovered patients, so that well, patients suffering from the illness will know what is going to happen and will have the motivation to fight the illness. Thank you, Mr. Ho. Next is Ms. Katharina Rima.
I'm representing the Karen Leung Foundation. We are a Hong Kong-based charity which is looking after the early detection and prevention of cervical cancer as well as the gynecological cancer. Now, we would like to make the government aware today of the gaps in the inclusion of the HPV vaccination into the early childhood immunization program of Hong Kong. Now, we can identify two service gaps here which we would like the government to address. With the starting program, it only covers girls that are grade 5, aged 11 years old. Now, what happens to the girls which are turning September 2019 when the program starts 12? Also, the WHO recommends that girls should ideally receive the vaccination before they become sexually active or exposed to the virus. Now, the median age for that in Hong Kong is 19. So again, so the gap is 12 to 19-year-old girls. Additionally, about 3,500 girls arrive in Hong Kong after the age of 11. So those gaps, those girls will again be missing out. The second important factor to increase a high uptake rate of the vaccine is knowledge. Knowledge is power and key of acceptance. Unfortunately, females in Hong Kong are lacking severe understanding of the HPV vaccine, cervical cancer, as well as underestimate the risk of infection. Secondly, parents and parental consent is very important. Now, anti-vaccine stories or anti-vaccine campaigning, as well as parents having misconceptions that vaccination could lead to early sex experience, may adversely affect the uptake rate. So therefore, the Karen Leung Foundation makes the following recommendation to the government. We would like to recommend to the government to consider to extend the current cervical cancer vaccination pilot scheme to all girls aged between 12 and 19 or not just low income. So that would be a cost-effective way to addressing the service gap by simply extending an existing program which is carried out by the FPA at this point. Secondly, we would like to suggest that the government may consider public-private sector partnerships to partner with NGOs such as ourselves or other NGOs which have access to the school setting and to students to provide appropriate education and awareness programming together with the vaccination program carried out in schools and to address parental misconceptions and constraints. Thirdly and lastly, we would like the government to take the lead in promoting appropriate vaccine uptake in general to the public, and that could also help address the uptake of the HPV vaccination. Thank you very much.
Okay, thank you, Ms. Corinne. Okay, Zhao.
We still have two deputations and individuals waiting to speak. Mr. Mack. Samuel Mack. I'm from Cancer Strategy Concern Group. Well, we're here to talk about the overall strategy for the prevention and treatment of cancer. I would like to say something about prevention and treatment. Say, for example, colorectal cancer. Starting from 2018, that was the phased program for those between 50 to 57 for early identification of colorectal cancer. It is a screening program, it's very good. However, when it comes to breast cancer, a lot of people think that it is a woman's illness. I would like to say that breast cancer is not an illness for women only, and it's also about it will affect the entire family. Children and husband of breast cancer patients suffer as well. Previously, I spoke in a radio program with Mrs. Fogg, who is the president of Breast Cancer Association. We talked about the importance of breast cancer screening. I can tell you about my personal experience. My mother was diagnosed with stage 1 breast cancer. She was cured. I know that I'm very lucky. I'm aware that for a lot of patients, they are only diagnosed at, say, stage 2. If there is a territory-wide screening program, I'm sure that a lot of these cases can be prevented. Well, whether it's a 2D mammography, Mrs. Fogg also talk about a 3D mammography. They provide very accurate information, and the percentage of a false diagnosis is very low. The financial secretary said that $5 billion will be earmarked to procure new equipment. If there is new technology, say for example 3D mammography, and the TT field as mentioned by Dr. Lee, can these new technologies be introduced in Hong Kong? So that, these cases can be diagnosed early. Thank you. The last person to speak is Mr. Anthony Lai. Please speak on the microphone for number 7. We have submitted a submission. We have already stated thereon that a lot of things can be done about prevention. A number of deputations talk about drugs. But in the entire process of cancer treatment, there are many stages. The first is the prevention, second is screening, the third is treatment, and the fourth one is palliative care. And for recovered patients is rehabilitation. Each stage is equally important. For our group Health in Action, we think that the government can do more in relation to prevention. In this regard, both for the HA's Hong Kong Cancer Registry, they've only identified the most common type of cancer. Of the 30,000 new cases, there is no information about their lifestyle, the diet, there's societal information and familial information. Without such information, it is difficult to formulate a local prevention strategy. In the past decade, we have seen a 30% increase, which is quite high. So we have to have a targeted efforts to lower this rate. As we all know that one's lifestyle and the environment we're in will affect the mortality rate. There are a number of factors that would affect the risk. There should be a dedicated committee set up. The committee should look into the effectiveness of various strategies, say for example food health, occupational safety, air pollution, prevention and education. We ask the government to consider more in this regard. Thank you. Thank you, Mr. Lai. Next, I ask government representatives to speak. Dr. Choi, what do you have to say in response to the comments made by deputations and individuals? Thank you. I thank those who have attended. We have heard comments from cancer patients or families of cancer patients. We fully understand that when someone has cancer, it will have a huge impact on themselves and on their family. It is a difficult time, and I thank you for coming to share with us your views. I will pick a few of the important or key areas and reply to them. Yes, the government can do a lot of work in many different aspects, directly and indirectly, to enhance public health and to reduce risk factors. Let me give you an example. Well, recently we have this as a smoking public health amendment bill. In the public hearing, we explain why we use a legislative amendment approach to ban the sale and advertisement of e-cigarettes. We have heard different views, some for and some against. From the Food and Health Bureau, we have the duty to protect public health. Our prime consideration is in relation to new products. When the smoke coming from these new products is not as pungent and more easily acceptable, it may create more problems.
There will be more cases of chronic illnesses, including cancer. Because of this, we are of the view that this approach is really necessary. So please support our new legislative proposal. Concerning prevention, we are talking about the future, those who are not ill yet. We have a non-communicable diseases strategy for 2025, and in it, there is smoking, consumption of alcohol, physical activities, and obesity. These are very basic health guidelines, which are known to even primary students. However, not all members of the public believe in them. So in the process, the Department of Health and the government will continue to do more publicity and education. First, let's talk about alcohol. The WHO said that alcohol is the first kind of substance leading to cancer. So if we are to do more on that, still there will be a lot of queries, doubts, and also resistance. So we have to do more. And then concerning screening, just now you talked about different types of cancer like breast cancer, lung cancer, and cervical cancer. It is difficult for me to comment on each, but let me tell you. Under the Coordination Committee, there is a working group of experts on screening, and they will regularly examine 9 types of cancer which are of concern to most. colorectal, lung, nasopharyngeal, thyroid, cervical, prostate, ovarian cancer, and so on. So their strategy includes both prevention and screening. Now let me talk about breast cancer screening. I have heard comments from a number of deputations just now. We have commissioned the Hong Kong U to do a study or survey, and they have been doing it for a long time, and in second half of 2019 they will complete analysis of a few thousand cases. With that report, we will discuss in our meeting about the territory-wide breast cancer screening. Because when we consider this kind of strategy, we have to consider overseas practice and also points to consider for implementation. The third point is about support for the surviving or recovered patients. We do agree that this strategy should be strengthened. So in the cancer strategy paper that will be issued soon, there will be a chapter on the strategy for recovered patients and how we're going to help them. So we will beef up that part. Just now, a number of deputations talked about drugs, new treatment modalities, and also support or financial assistance. In the first part of the year, there's a mechanism on how to enhance the financial assistance under Samaritan Funds and CCF. Special consideration is given to the middle class people. Pharmaceutical companies do research very fast, and they are also quick in launching new drugs. Sometimes we can't really keep pace with them. Now, when new drugs are introduced, because there is a lot of R&D expense involved, so the new drugs won't be inexpensive. For the middle class people, not the grassrooters, when they face a long-term burden of drug expenses, we want to see whether there are any mechanisms to alleviate their burden and to reduce impact on themselves and their family members. When they have to pay for expensive drugs for a long period of time, there'll be a lot of disputes in their families and also worries. These are all understandable. In the past few months, some improvement was made, and we had undertaken to this council that we will report to this council later the effectiveness of the new mechanism and whether there will be review in the days to come. So this is my preliminary response. Thank you, Chairman. Dr. Koh, are you going to make response on points related to HA? Because sometimes patients see doctors every time, and they see different doctors every time. So patients have a reduced sense of security, and sometimes they have to wait a long time at the outpatient clinic department. Some deputations asked whether hospitals and pharmaceutical companies can work together to offer more concessions. For advanced stage patients, are you going to consider some guinea pig plan? Why do cancer patients need to pay for their own genetic test? Why not the hospital authority? For Samaritan Fund and CCF, can they meet 4 times a year? Now only 2 times a year, and it is taking them too long to give approval. So can Dr. Koh please make some response? After that, I will invite questions from LegCo members. Dr. Koh. Thank you, Chairman. Let me respond to points made. Thank you very much for all the comments, especially those who had the experience. They have shared their own personal experience, which give us a lot of reference value. We do understand the difficulty. Just now, some deputations said that the pressure of the oncology clinic is very big. That's true, because manpower turnover is big. And comparing with 10 odd years ago, treatment is now more complicated. So we will work hard to improve the workflow in the clinic. There are some good points made by deputations we'll go back to consider. Regarding the patients, now for colorectal cases, cancer cases, some case managers will help in examination and therapy. They will also help to give support. Deputations talked about support from specialist nurse and also pharmacists, and we will think of all these as well. Just now, the chairman and some other members referred to new technology like genetic test. We do have the plan to bring these tests into Hong Kong. Generation sequencing, as mentioned by Dr. Lee, may be brought in. But of course, we have to train colleagues, especially colleagues in the laboratories. And then another point is this year, the government had earmarked 5 billion for us to buy new equipment. The government supports the use of advanced equipment. So now there is the mechanism to speed up the introduction of such new equipment. But of course, we also need to do training. These are some directions that we are looking at. Some patients groups talked about drugs and medicines. Over the years, we have discussed with pharmaceutical companies on different options. For instance, this sharing program, it is a kind of agreement with the companies. The contract has to be kept confidential, but, well, for example, at a certain stage of use of a medicine, then some capping program can be brought in. And deputations refer to performance-based arrangement. As Dr. Choi said, now there are many new drugs, but the data on their efficacy are not that rich. We had taken reference from overseas countries. When data are not that mature, the drugs can only help a small number of patients. And in other countries, there is agreement with the pharmaceutical companies. So in cases where the drug is efficacious, then fee will be charged, and vice versa. This is a direction we are looking at. There are pilot schemes in other countries. Just now, the chairman also asked a question. We are working with various pharmaceutical manufacturers on clinical trial. In the initial stage of a new drug, there's the need for R&D to prove the efficacy. But some drugs seem to be promising. So we will discuss with the manufacturers. We want to encourage them to include patients in Hong Kong in the initial R&D work. As you know, for many big trials, they take place in advanced Western countries. For some cancer drugs, they are targeted at certain genes, and the therapy or the efficacy is different. So we are working hard with pharmaceutical companies to see whether their trials can involve our patients. Of course, there is the need for consent from Ethics Committee. But I think all these options can be considered further. Dr. Ho of Department of Health, do you have any response? Dr. Ho, please. Thank you, Chairman. Some deputations showed concern to HPV vaccine. WHO, some time ago, stated their position. They also reviewed overseas literature. So WHO recommends that girls between 9 to 14 years old should get this kind of vaccination. Those above 15 years old may not be covered in a cost-effective manner. So the Science Committee of the government has taken reference from overseas data and also WHO's recommendation. And so our recommendation is that HPV vaccination should be incorporated into the vaccination scheme of children in Hong Kong. And starting from next school year, free vaccination should be offered. And the first injection will be in P5, and then the next one will be P6. And then we will pay attention to the coverage rate, and we will step up publicity and education. Thank you, Dr. Ho. Now, we will open the floor for members to ask questions. 4 members had indicated their wish to speak. First, Ms. Wong Pik Wan. Chairman, thank you. 3 minutes each. Thank you, deputations, for sharing with us your concerns. I would like to get more information from the government. Para 5.
In paragraph 5, in the paper, there is this cancer expert working group on cancer prevention and screening. They have made recommendations on screening for 9 selected cancers. I would like to get that report so that I will know what are the specific recommendations. Just now, the Undersecretary said that they would like to get a comparison of the approach of different jurisdictions. I hope that in the next round of papers furnished, apart from this report, we would like to get some information about government support in other jurisdictions and whether there are different approaches. Give us more information about, say, for example, patient contribution to self-financed drugs. We will not be able to. We are not privy to the report unless we are members of this subcommittee. And I would like to also ask information about public hospitals. In paragraph 16, it says that from diagnosis to first treatment for colorectal cancer, breast cancer, and nasopharyngeal cancer, they will have to wait for 74 days, 65 days, and 56 days respectively. What about thyroid cancer? How long is that wait? I received some cases for requesting for assistance. A patient went to the Eastern Hospital in January, but he had to wait for 3 months before PET scan and other tests were done, and there was a diagnosis of thyroid cancer. Lymphatic cancer. Well, I don't know when. Well, he doesn't know how long more that another wait is going to be. So He has already waited from January to April, and then there will be another wait. And no one told him what kind of treatment is available. So I'd like to ask the FHB as well as the HA for the 12 types of cancers from confirmation to first treatment. Can you give me the information? And from first consultation to confirmation, how long do they have to wait? So they went for the doctor consultation, and then for examination, how long will that wait be? The long waiting time will make the situation worse because the cancer may spread. Perhaps after the wait, you will have to use more expensive targeted drugs, whereas with a shorter time, you don't have to. Will you give an undertaking that the waiting time will be shortened and the waiting time for treatment will be shortened? What is lacking? Manpower or resources? Are there any ways to address this situation? You have overrun. There aren't many members here. 3 minutes is not enough. I hope I will be able to get some answers. Let's hear a brief response from the administration first, because we have to leave time for other members. Dr. Cole. We have identified specific types of cancer. Well, there are many different types of cancer. For some types of cancer, it is easier to standardize the information. For others, there are many variants. It is more complicated to try to work out the time between confirmation and treatment. So it's difficult to come up with the information. The biggest difficulty for the long wait is manpower, operations as well as treatment. For colorectal cancer, usually it involves surgery. We have a very tight manpower for surgeons as well as anesthesists. We're doing lots of work. Well, we have increased the number of sessions of operating theaters. For some patients, we have strengthened our evening service. If there is radiotherapy required, we will try to increase manpower. But what about the report of the recommendations? Can we hear from Dr. Cui? We will follow it up to see if we can give you the information. Next is Mr. Poon Siu Ping. Thank you. I thank deputations and individuals for coming to speak to us. Just now, the Undersecretary said that before the end of the year, there will be a report on cancer strategy. Some people talk about recovered patients and support as well as re-employment. I would like to ask about progress of the strategy. Is the Cancer Coordinating Committee set up in 2001 responsible for that, or is it the responsibility of the FHB? The role of Chinese medicine, will it be mentioned in the strategy? I would also like to follow up on something else. Cancer treatment under the HA. It says here that the HA will continue to increase the number of sessions of the operating theater. There will be enhancement of facilities. and enhancement of service capacity. Dr. Cole said that they are facing tremendous pressure and there is serious wastage. Do you have any specific measures to increase manpower, including nurses, doctors? In paragraph 3, it says here that, the service capacity of radiology will be increased. Dr. Choi? It is the Cancer Coordinating Committee that discussed about the formulation of the strategy. The HA may be more involved regarding treatment, and the Department of Health may be more involved in relation to screening. But it involves other policy bureaus. Someone mentioned about labor laws and reemployment. Will it be discussed by the committee as well? We'll first focus on what the policy bureau can do. Well, for the other issues, it may not be covered by the report. The member asked about Chinese medicine. Development of Chinese medicine and cancer treatment take place at the same time. It may not be covered a lot in the report, but development of Chinese medicine is also a key area of this government. That includes development of Chinese medicine hospital, Chinese medicine practitioners and products. So there will be a lot of opportunities to involve the Chinese medicine in the treatment of cancer. Next, Dr. Fernando Zhang. I thank deputations and individuals for coming to speak to us. They have spoken about the personal experience or experience of their family. We think that given the fact that Hong Kong is an affluent society, it is also an advanced economy. However, our patients suffer a lot. Say, Mrs. So. Mrs. So has a child that suffers from mental impairment. Well, by child, the child's already in his 40s. The doctor prescribed some advanced drugs, a third-generation drug, and he's also said that her condition has greatly improved. This is suitable treatment, but we know that it's the government's healthcare policy that no one should be deprived of a suitable care and treatment because of lack of means. What is meant by suitable care and treatment? We believe that is the judgment of doctors. Well, according to the doctor, this kind of drugs is suitable for the treatment of the illness. But because of lack of means, Mrs. So can't have the illness treated properly. Mr. Leung from the Liberal Party has also made it very clear. Someone from the middle class or a breadwinner of a well-off family will all of a sudden become the burden of the family. I don't know what specific measures will be included in the cancer strategy. We're talking about saving of lives here. We would like assistance to be given in time. We do understand that public money has to be well spent, and it has to be spent in a responsible way. Regarding treatment, screening, support to recovered patients, they all require resources. But we're so poor that all we have is just money. So these can all be done. Well, this is the end of April. You say that the report will be released in 2019, but you can't give us a time. I am concerned that there is no patient representative in the coordinating committee. They will all be just experts. This coordinating committee was set up in 2001, but since its inception, the situation of cancer patients, number of cases, and the level of information transparency have not improved at all. And Health in Action has also spoken. Well, there are a number of factors, say for example, lifestyle, the environment, that affect the illness. We have experts, but you can't come up with the data. There are so many issues to be covered. I think that we have to take it step by step, and we will have to go over the list of different types of cancer. We don't know how many meetings are convened over a year by this coordinating committee. Well, the recommendation committee for drugs said that they have already doubled the number of meetings a year, which is only 2. So our cancer policy is so backward that I don't think I can trust this panel of experts anymore. The platform should be open for all. And this subcommittee is a very good platform to proceed. We have to have a comprehensive review of cancer policy. This is exactly what we're going to do. We will have a meeting every month for the coming 12 months, and in each meeting we will set a topic. We will talk to members about what topics it's going to be, and I don't know the possibilities of more than 1 meeting a year.
We will discuss things of concern to all. Now, every year there are more than 10,000 people dying because of cancer, and some have not received appropriate treatment. So we should speak for those who had died in an unjust way. Now, Ms. Chen, thank you, Chairman, thank you, deputations. I think what you have mentioned fall into 4 categories: treatment, diagnosis, rehabilitation, and support. And the government has given the usual response. Just now, the Secretary talked about the 2025 Strategy and Action Plan. This is not unique in Hong Kong. It is to reduce the prevalence of 4 non-communicable diseases, and it is an objective of the WHO. If you say you want to discourage people from smoking, alcohol consumption, being obese, and so on, well, this is just the old mentality. It is the established approach. In this subcommittee, I hope to see more specific approach. Just now, the Department of Health said that starting from the next school year, for P5 students, there will be free HPV vaccination for girls. Well, this is at least a new approach, not an existing one. Now we have the coming CE for HA, and there will be 5 billion from the budget earmarked for the purpose. So for cancer, are there any ways to speed up diagnosis and treatment? For example, MRI equipment? Can you buy a few more machines with the 5 billion so that you can speed up diagnosis? And when it comes to gamma knife, well, perhaps it is only available in 1 to 2 hospitals. Can you buy more with the 5 billion? I remember that the Financial Secretary said that one purpose of this 5 billion is to help the cancer patients. So in relation to diagnosis and treatment, out of this 5 billion, can you at least tell me what more equipment and machines will be procured to buy the cancer patients? Now, there are 9 main types of cancer for the screening scheme. Now, just now you mentioned breast cancer, and for prostate cancer, usually PSA index can be checked based on blood test. Then you will be able to tell the risk of prostate cancer. This is very fundamental. So you can just do a blood test. Is it true that you can't do it? You still need experts to tell you what to do? Now, population is aging. For male, if they do not die after 90 years old, surely they have problems with their prostate. So shouldn't there a blood test regularly to check the index? That is really simple. When it comes to primary care, the hospital authority has a community health center. And the CE, in his 2017 policy address, talked about district-based public-private cooperation. That is the district health center. So there is blood test, support, and also vaccination. So can D of H do some district-based coordination so as to achieve prevention? You should not wait till the confirmation of breast cancer or prostate cancer for surgery to be done, and then some kind of palliative support. Ms. Chan asked many questions. A lot of your questions are related to equipment. Later on, there'll be a special meeting on equipment and devices. You have already used up your time. Well, can the government give a written response? I believe deputations would like to get a brief response. Dr. Choi? Right, yes, let me comment. About hospital authority, perhaps Dr. Koh can supplement later. For the 2025 territory-wide health education strategy, that is one of the methods. Some deputations said that they would like to know what measures will the government offer to do prevention and screening. As such, is now the experts working group keeps on reviewing new evidence about territory-wide screening or survey. We will consider a series of conditions. In many other countries, they are of the view that survey has both pros and cons. Good points are that there can be early identification, but then if there is a territory-wide survey, there may be excess treatment, excess examination. In some countries, the survey scheme is being withdrawn after some time. So it is not that surveys are always the best. We have to consider many other factors. And then in the first stage, we will concentrate on commonly seen non-communicable diseases, prevention, and examination. Let me give an example related to breast cancer. Secretary, can you please be brief? Some other members also would like to speak. Well, for self-screening on breast cancer, we can teach women how to pay attention to the health condition of their own breasts. This is a very effective preventive method. Mr. Elizabeth Kwok, Kwang Chun-yu, and Tommy Zheng would like to speak. After they ask questions, we will adjourn our meeting. Ms. Elizabeth Kwok, thank you, Chairman. Thank you, deputations. I have listened to each and every word of yours, and all the points and questions that you have raised will be taken up by this subcommittee. all along, I have been promoting prevention and screening. For instance, for HPV, the government will offer vaccination for P5 and P6 students. In fact, for women below 24 years of age, there should be a catch-up program. So service can be offered to these women at one go. I hope the government will give a proactive response. For a breast cancer survey, well, if the hospital authority is talking about excessive treatment or excessive examination, well, just imagine if the patients are your family members. Right, there may be false alarm. So at the end of the day, you can have a peace of mind. Or on the other hand, it is a confirmed breast cancer case, but it has been diagnosed at too late a stage. Now, I have asked the dean of some hospitals. Well, he said that he would advise his family members and wife to get examination earlier. We have been talking about this for more than a decade, and you said that you have commissioned Hong Kong U to do a research. How much more time do we need to wait? How many more females do you want to see suffering before you can be empathetic to them? Today, I have to thank the NGOs who have shared their recommendations. There are former patients who are willing to be volunteers to help other patients. This is a very good social resource. For these very passionate NGOs, what kind of support can the government offer? They are asking for more support from hospitals, but can you give NGOs more support in terms of manpower and other resources so that they can help more patients? Family care has been discussed for a long time. There are the drugs available, but people can't afford them. This has been a long-standing matter. The last budget earmarked 5 billion for CCF to help the cancer patients and patients with rare diseases. How are you going to spend the 5 billion? Today, I really feel saddened. I have to thank Dr. Lee. He said that he wants to use new equipment and new methods for treatment, but he cannot solve the problem, although he's working with the hospital authority. Now, he is coming to LegCo to seek help, so he needs LegCo members to support him. This is unacceptable. There is a lack of communication between doctors and hospital authority. This is really ridiculous. And there is high wastage of doctors. And for oncology department, there is a particularly high wastage of doctors. Well, many oncology doctors said that they are not able to help the patients and they don't want to suffer from depression. So what kind of management are we talking about in the hospital authority? If there is time, we should discuss each and every item one by one. Today, even if we ask the government to respond, they will just be delivering a very official line to take. We don't know what they are doing. I think a very detailed account should be given to us. A written reply should be sent to us on the composition of the expert group, how often do they meet, and how are they going to help the cancer patients and their overall strategy. Please give us a written report, and in our next meeting, we can discuss the report. Otherwise, if you give us the same answer, we don't have enough information to debate with you. Thank you. Right. So member would like to get more details about the expert working group. Mr. Kwang Shen Yu. Thank you, Chairman. Thank you, deputations. I have to thank the convener of the Cancer Concern Group. It is early last year that when we convened the first public hearing centered around cancer. Back then, there were voices that we should expand the discussion topic, and we said no because within this legislative term, we had not conducted a very targeted discussion on cancer. And then all the way till 2025, according to the policy address, there will be a direction, a policy around cancer. In fact, cancer patients face huge pressure and also their family members as well. And these pressure can be avoided by some systems. For example, there can be early identification or diagnosis, and after cancer is diagnosed, do the families need to spend all of their savings? There are problems in the hospital authority. There is inadequate communication. So I hope that all these points can be raised. There is one important point about safety net and drug formulary. How can we help grassroots to have cancer treatment? I would now like to ask Dr. Choi. I am a member of the Poverty Commission, and my impression is that when there is a new disease, when there is a new drug, the government will say, okay, this drug is fine. And let's say a certain medicine is being discussed in LegCo, then they will consider incorporating it. And there is a medicine for lung cancer which can lengthen survival of a patient. So this medicine name may be heard by the government during a debate, and so they will add that to the list. Well, this is not acceptable. It is now 2019, and all the way to 2025, there will be a development policy. Well, are you now really ready? Are you going to do a review of the drug formulary in principle? Yes. Thank you, Chairman. Thank you, Mr. Kwong. Regarding drug formulary and also financial assistance, we know that many members of the public are concerned about it, and the mechanism is being improved on.
Well, that in some way is something to do with the cancer strategy. Well, some people talk about prevention, early identification, screening, treatment, and support, research. Well, the scope is wider. It will go in tandem. I asked about the timetable, whether there will be a review in principle. Yes, you may set a timetable that will take place between now and 2025, but do you have any plans to conduct a comprehensive review? I would like to talk about one area, subsidy. Administrative issues, say for example within the HA, whether vetting of drugs for inclusion in the subsidy program can be expedited. It is an ongoing process, and there is also the CCF subsidy program and various subsidy program on for expensive drugs. Well, we will report about our progress, about the way forward. It doesn't matter, Mr. Kwong, because there will be a dedicated meeting. We will work with them in the review of the drug formulary. Mr. Tommy Zhang, you're the last member. Yes, I thank you for allowing me to speak. I know that we have overrun. I thank deputations and individuals for coming to speak to us. I have spoken to some of them. They said, well, why are you here? Well, you are an HA doctor. Why don't you simply talk to the HA? What we can see is that it is difficult for frontline doctors to talk to the HA management. Is it better to talk to the LegCo? I don't think that is necessarily the case. Well, I do believe that Well, there is a group of people who is trying to prevent anything from happening because they want to keep their income. Under Secretary, you've worked in the HA before. A couple of years ago, there is a body set up by the loyalists. Well, Rebecca talked about something. She said it really well. It's about the use of drugs to cure rare diseases by the HA. Well, it would take over 10 months. The HA might agree with it, but if individual hospitals would like to use that drug, they will have to spend another 10 months trying to get it approved. This is really bureaucratic. If the HA has already approved that, why don't they simply just keep stock of the drugs for hospitals to use instead of asking individual hospitals to spend another 10 months just to procure the medicine? Well, the bureaucrats would require you to spend 10 months after 10 months just to buy drugs. I'm afraid that you won't be able to answer all the questions, but please follow up on this. No one knows better about these problems than you. You now wear a different hat, and I think you will fully understand, and I hope you will actually do something. Any reply from Dr. Choi? I thank Mr. Zhang for the question. We're aware of these problems, that approval might have been given, and the introduction of drugs by individual clusters may be duplicated. Well, it is under review. Let's hear from Dr. Cole. Just a short reply. As Mr. Jones said, that there has been a number of discussions about this topic. We're working on an improvement. We have talked to different clusters about how to address the problem. There is a mechanism to improve the situation. There are 7 clusters, and they have their own pharmacies. Was for some treatment, it is the responsibility of certain clusters. So the drug won't be stocked in all clusters. If a drug is needed, and if it is the patient should be able to get the drugs whichever cluster he is in. We have already notified all our pharmacies to let them know that if a certain drug is prescribed, and if that particular pharmacy doesn't have it, they may arrange for it to be transferred to that pharmacy. But it may be the case that the drug is rather new, but we still have the responsibility to make referral for the patient to go to the right cluster for the treatment. This is a new mechanism that has just been put in place. We will closely monitor to see if this new mechanism is effective. The next meeting will be about prevention and screening of cancer. We will discuss the various issues involved. The next meeting is tentatively set on the 20th of May at 2:45 to 4:30. There being no other business, the meeting is adjourned. I thank deputations and individuals for attending. I also thank the HA, the DFH, as well as the FHB for attending.